How are we going to do that? And that needs to be done very urgently.
All right, we are hoping to speak to her a little bit later on. The board chair of the South African Health Products Regulatory Authority, Professor Helen Rees, says they are in discussions with several bodies, including the Health Department and the Ministerial Advisory Committee, on the need for a national protocol to look at the effectiveness of a vaccine.
Remember that we're rolling out at the moment 2 vaccines, but in the future we're very likely to roll out more vaccines. And as we've just heard, we've now got a new variant. And every time you see a new variant, we immediately have to ask the question, will the vaccines that we have work at all, work as well, work for mild and moderate disease, work to stop transmission of the virus, and very important, most important at the moment, work to prevent severe disease and hospitalization and death. So we have a protocol that's going to look at the effectiveness of vaccines once they're rolled out. And the way that we're going to do that is that we will look at what are called breakthrough infections. These are infections that people acquire with COVID who've had a vaccine. And then there are a lot of questions we have to ask if we see a breakthrough infection. Has the person had a vaccine? Did they have 2 doses if it's a 2-dose vaccine? When did they have their last dose? Because remember, vaccines don't work instantly. They take several weeks to really get an optimal effect. And then we ask, how severe is the illness? Does the person have other comorbidities? What age group are we seeing these breakthrough infections? And importantly, we will be looking to see what is the COVID virus that's actually caused that breakthrough infection. And that will start to give us a pattern of whether, in the case of the Delta variant, we're seeing what we're seeing in terms of the effectiveness of vaccines. And Richard just showed you very nice slides from the UK that showed the effectiveness of the Delta vaccine with the AstraZeneca and the Pfizer vaccine. And that's the other thing to remember, is that as the Delta vaccine is becoming so prevalent across the world, that we are going to be able to draw on other countries' experiences of using vaccines that we're also using, and we'll be able to look and see what they are establishing in terms of the effectiveness of